Hey everyone, today I'll be talking about AI and healthcare and how we are harnessing AI for medical breakthroughs here at the University of Oxford. My name is Ikboljon Sobirov and I am a PhD candidate and AI researcher affiliated with AMIC and Crystal Diagnostics. Today I'll walk you through different applications of AI in medicine and briefly talk about what cardiovascular disease is and how AI can play a role in the management of cardiovascular disease. There are two interesting topics, so-called radiomics and transcriptomics. I'll briefly describe what these two are and how we are um, taking advantage of the two for personalized medicine and what my PhD is all about. And I'll wrap up my presentation with a small conclusion. So, in today's era, AI has been playing a lot of role in different aspects of our lives, including the healthcare sector. So, more more and more AI-backed technologies in the field of medicine is getting FDA approvals, and many startups are popping up these days. So one of the most common applications of AI is early diagnosis. So it can automatically diagnose a person a person with different types of diseases well on in advance, and it can give the clinicians a chance to speed up their process. Another application would be prognosis. So this one is about telling the risk of a person based on their current condition, the risk of a person developing a certain type of a disease. It can be, for example, cardiovascular disease, or it can be cancer and many other types of diseases. And there's more coming on the horizon. So we've got treatment, drug discovery, personalized medicine, and a lot more coming up and in active research right now. So you can see here a few more applications of AI in medicine. So what is cardiovascular disease and how AI sort of relates to that to our project? So cardiovascular disease is unfortunately the leading cause of deaths worldwide and in Uzbekistan. And annually we get almost 18 million deaths globally. So the plaque itself, or the cardiovascular disease itself, is here you can see the heart, and these are the blood vessels or the arteries that's wrapped around the heart. So they're called coronary arteries. So this type of disease is called a coronary artery disease. Here we can see the zoomed in version of that. So you can think of this as a small pipe, and then the water flows through the pipe. So very similar to that, the blood should flow through the vessels smoothly. But unfortunately, over time, because of diet, because of wrong diet, wrong exercise, or not doing any exercise, and different types of other reasons, cholesterol plaque buildup happens. And then whenever there is a full blockage of this kind of plaque within the vessel, that's when the heart attack happens. So, how do we do the management of cardiovascular diseases? So there are different imaging modalities like computed tomography, MRIs, ultrasounds, X-ray angiography, and many more. Here we can see an example for a CTA. This is computed tomography angiography. Here, for example, this is a blood vessel, a coronary artery, and this is the whole heart, right? And this is the chest area. On top of that, whenever clinicians perform open heart surgeries, they take biopsies, right? So tissue samples, and then from these biopsies, we can extract DNA and RNA information, and then we can apply sequencing to that. And finally, we've got electronic health records that keeps record of medical and demographic information for patients. So there is this a bunch of different types of data for a patient that comes here with you know, complaining about their heart, right? So in our team, what we have developed so far is here you can see that CTA, but run in the heart getting rendered in 3D. This is a blood vessel or the coronary artery. So our medical team has proposed to study the perivascular region that includes a wall and whatever is outside the wall, right? Ignoring the blood vessel, so ignoring the blood itself, right? So whatever's out outside the blood, that includes from the inner wall to all the way to the outer wall. So we're interested in studying this region, and we have already developed fat attenuation index. This is a biomarker that can tell us the risk of a person developing a cardiovascular disease well in advance. It can be, for example, in 10 years ahead, it can tell if a person is eventually going to develop a cardiovascular disease. And this has been already proposed, and what we are trying to do is to come up with new biomarkers, right? So for that, there are two interesting topics, radiomics and transcriptomics. So radiomics is about radiology, right? So we get the radiology imaging data, and then we perform segmentation of certain types of regions. So that includes, for example, the coronary arteries. So this is where we apply deep learning, right? This is one of the easiest applications of AI. So we can see as a typical CT with a tumor highlighted, but in our case, it's different vessels. And then using these segmentations, we extract different features, again, using typical machine learning approaches. And then those features are then used for our analysis. Now, transcriptomics, again, is from the word transcriptome, which is related to RNA. So that we get different tissues of interest, and then clinicians perform their typical procedure. We get RNA, we extract the RNA from that. That RNA data go through, and then we get the RNA sequencing data. So that's what we are interested in. So this sequencing data, along with a typical machine learning algorithms, again, can be used for our analysis. So my PhD specifically talks about these two topics, or rather combines these two topics into the same pipeline, so-called radiotranscriptomics. This is a rather new field of study. So take this as a damaged heart, right? And we can see that here we've got a plaque buildup. So what we do is get RNA data from that during an open heart surgery. The clinicians get an example and give us, say, RNA sequencing data, performing their typical procedure. So that RNA sequencing data is sort of used as a ground truth, you can say, in our analysis, and we align this ground truth data with the segmentations and radiomic features extracted through from the imaging data. So by aligning these two, we understand the relation between the transcriptome and the imaging data, thereby giving us the option to develop new radiotranscriptomic signatures. So fat attenuation index earlier, as I mentioned, the phi score is one of these types of signatures, and our goal is to build new biomarkers that essentially gives us different types of signatures or biomarkers that gives us a chance to perform early diagnosis. And using these signatures, we can also build the risk models for early diagnosis and for personalized medicine. So that's pretty much my whole PhD is all about. And we can understand that there's a good potential of AI in healthcare, so in the healthcare sector, and we should be aware of what are the applications and how we can use that, and how AI is currently used in the treatment and in the management of this serial killer cardiovascular disease. So in our team, we are taking advantage of multimodal data and then integrating the information extracted from two different types of omics data, so that we can provide early diagnosis and eventually provide personalized medicine for patients with cardiovascular diseases. Thank you very much. If you have any questions, you can find me with a Gmail or here on this Telegram channel. That's all from my side.